Miami's top surgeon speaks on athletic injuries, on hand and upper limb treatments. With the different sports in full swing this summer, it has become extremely important to stay informed on the different types of athletic injuries and how to prevent or treat them. Dr. Alejandro Badia is the leading hand and upper limb surgeon at Badia Hand to Shoulder Center in the U.S. As an orthopedic surgeon, Dr. Badia treats a large variety of sports injuries to the upper limbs.
That is one of my particular areas of interest, and in fact was recognized as the worldwide president of the International Society for Sport Traumatology of the Hand.
He says this entails a variety of sports that use a lot of hand movement, with baseball being only a small portion.
Other contact sports such as rugby, basketball, or boxing, including all of the martial arts, obviously have a lot of hand injuries, but it should be noted that wrist injuries are also a major component. In particular, golfers and tennis players have frequent wrist problems. They often have elbow and shoulder issues as well, which I treat since my practice is not limited strictly to hand and wrist.
Dr. Badia says he has treated many athletes in the Cayman Islands and has been here to predominantly visit with the island physicians to create relationships, since there isn't a dedicated orthopedic hand specialist on island.
Particularly one who does a great deal of arthroscopy or minimally invasive surgery like is done in knees and shoulders. I tend to come to the Cayman Islands at most once a year, so it is not to treat or even see patients, but rather to do some follow-up and to also visit with the therapists, which is a critical part of recovery after any upper limb procedure, particularly in an athlete who is so motivated to return quickly to work. The same is often true of manual laborers.
According to the Consumer Product Safety Commission's National Electronic Injury Surveillance System, more than 1.9 million individuals had a sports-related injury that was treated recently. Among those injuries are broken and/or dislocated fingers and wrist bone fractures.